Yeah, that's me. Okay, so holistic iridology, and we're talking about, and there's so much to do and so much to share, but this particular, I'm going to focus on interpreting your thoughts and emotions through iris structure, color, and accumulations. So let's go. We've got Dr. Pesek's Holistic Iridology, leading edge system truly. I've been doing this for 35, 36 years in developing holistic iridology. We have a school, an educational school. I know that some of my grads are out there watching right now. You can be very proud of this credential that you've earned through the International Institute of Iridology that has students and or graduates in 60 nations. The International College of Iridology, that's the professional association for iridologists. This is the organization that is producing this Congress for you. I always like to start my presentations, whether it's a lecture, a seminar, a 3-day seminar, senior level, 5-day seminars, wherever I am, we are all one, people. We're all one. We all come from the same divine source. And we just incarnate in these physical vehicles, these little bipedal carbon-based units that consume oxygen and glucose for energy, that we're all the same. We're all the same. And the quicker that general humanity can do something with themselves and understand that we all are one, we're going to heal ourselves and the planet much more quickly. And I love these 3 egg shell. It's only a shell. I mean, what a metaphor. It's awesome. And the children of the world, is we're passing this on, and everybody take a stand for, to help with global warming, climate change. Climate change is real. That's science. It's real. You're experiencing, you see it. Mother Nature has always been swirling and churning that with this planet being 5 billion years old. But right now, I think the humans are accelerating all of this. So let's be mindful and do your part to protect our planet for our children and grandchildren. What's the greatest healing power of all? You got it. Love. Love never fails. Love yourself, and then love others. Love who you are. The courses, what I'm going to be teaching you right now, the Holistic Iridology overview of thought and emotion, how you get to root causes of illness and disease, is acknowledged, recognized, and respected by and approved by the Continuing Education Department of the American Naturopathic Medical Certification Board. It's also the National Certification Board for Therapeutic Massage and Bodywork. Also, the World Association for Excellence in Health. They're based in Lima, Peru. IPA, the International Iridology Practitioners Association, Distance Learning Sanction Certificate. This is abbreviated, the Society for Research in Health Sciences, a medical society based in Bogota, Colombia. In fact, just a few years ago, I was privileged and honored to receive this Dr. Honoris Causa in Health Science, awarded for my research and development of holistic iridology. This is not any iridology. If you're new to this, this is not just physical iridology. This is something that is far deeper, that is leading the practice, the science of iris analysis well into the 21st century. Also, I'm a provider for continuing education by the National Board for Colon Hydrotherapy. There's a diploma program through, Silverio was talking about this, Dr. Salinas, with the massage school of complementary and alternative medicine just outside of Mexico City. This is the only iridology course certified, homogenized, pasteurized, bona fide in the country of Mexico. And I'm a gringo. I'm very honored. Back, I won't bore you too much more with this, but if I don't share this with you, you won't know all that I've done in 46 years in the practice of natural medicine. This is just a little bit of it. I was awarded the Grand Master Award for my lifetime of work in advancing natural medicine worldwide. This was in Assisi, Perugia, Italy, 2 years ago. What an honor. Something else that thrills me and it's an honor is that we have actually ongoing right now. Sukanya Manabal, nicknamed Yaya, is teaching Holistic Iridology Level 1 to nurses and other healthcare professionals in Thailand. And these are some of my students and her students. And they actually have the Pesek Iris Cam Multiflex. They have an association, the Thai Holistic Iridologists Association. And I'm really proud of this. There is actually a department of holistic iridology in Thailand in a hospital. In a hospital. Hospitals here in the US should have this. In Russia, only medical doctors have the privilege to practice iridology. I've been at this a long time. If you notice that logo on the bottom, it says 1983. That logo was designed. I had the concept. A graphic artist drew it. Later, it was colorized. But holistic health is a balance of spiritual, mental, emotional, and physical. It is not mind, body, spirit. Mind, body, spirit. Mind, body, spirit. Where are the emotions? Mind, body, spirit. Where are the emotions? It's a step in the right direction, but it's not fully holistic when you say that. What about your emotions? What about the powerful healing emotion of love? It's being left out in mind, body, spirit. Do you think love? Do you think love? Or do you feel love? It's got to be emotional. I guess I'm talking to you also as a psychologist because I've got 3 degrees in psychology. True healing begins on the spiritual level first, then into the mental and emotional levels, and finally into the physical body. This is the true nature of the healing process. Spiritual first, then your thoughts. What do you think? From your thoughts, it goes into your emotions, your endocrine system, limbic system, what your mind thinks and perceives, and then finally into the physical body. So if you want to heal something within yourself, let's say that you have a health condition that could be a degenerative disease, well, you've got to look at the roots emotionally and mentally. How did you get to that point of having a physical condition? The physical condition did not just happen. It's a cascade in this paradigm: spiritual, mental, emotional, physical. That is not a theory, folks. That's real. And that's the fundamental principle of holistic iridology, because what we do is get to the root causes of what's going on for somebody by looking through their eyes and seeing the thought and emotional patterns, as well as the physical genetic patterns. The various hereditary challenges, conditions, and accumulations seen in the iris, sclera, pupil, cornea, and conjunctiva, which is the anterior segment of the eye, they're not negative. Rather, they are to be considered as positive indicators of opportunities to heal oneself holistically. So if I look at your eyes and say, oh, there's a challenge here in the liver, there's a challenge in the pancreas, that's not bad. It's giving you insight as to what you need to do to help heal yourself or prevent ever having that degenerative disease, because you can see the underlying thought and emotional patterns that are leading to it. I'm looking for serious students who desire to become professional holistic iridologists. Are you one of them? Or if you just here to interest, and just see this out of interest and listen to my lecture, go, wow, iridology is amazing, especially Pesek's holistic iridology. That is really special, cutting edge. That's okay. Bless you. Whatever. If I can inspire you in this presentation to help change your life, to wake up something that's sleeping within your consciousness, it's not about you having to become a student, but some people will find me in this audience of nearly 500 from 29 countries. You'll find me. You've already found me. If it's meant to be, you'll feel that you want to study this. But I'm looking for serious people. This is a serious course. It's not hard, but it's serious. Level 1 certification, 3-day seminar. Level 2 certification, a 4-day seminar online. Level 3, a 5-day seminar, also available online. And then finally, the highest credential available, a diploma of holistic iridology. And as I said, I'm very proud, honored, and humbled to have students and graduates in 60 countries globally on every continent. Learn from the best. Maybe the old expression when I was a kid growing up, tooting your own horn, but I'll tell you what, I've traveled the world and I know what other people teach. And there are some good teachers with some good information out there, but you will not find anything superior to what I'm teaching you. This is just one graduation class that we do. And hopefully, for those of you that have already graduated, but you didn't get to go through this ceremony from the class of 2020 and this year, 2021, we'll be together in person in Orlando next year, third weekend of October. I think the number's 21. I'm not sure, but I'll let you know about that. But you come and go through and be honored for your achievement. Now, going back only 5 generations, your DNA contains information from 62 ancestors that can influence your experiences in this life. 5 generations, 62 people. I love this metaphor. Passing down, handing our genetics to the next generation. Passing down, passing down. This was taken with my iris camera, the Pesek Iris Cam Multiplex. I'm only joking. But this chart here, generational chart of holistic iridology. That's you. Let me find the cursor. That's you, a spiritual being of light. Yes, you, a spiritual being of light. Your parents, right? Your grandparents, your great-grandparents, your great-great-grandparents, and then your great-great-great-grandparents. You put all that together, 62 people are contributing and funneling their genetic influences on you, not just your physical body, your thoughts and emotions as well. The iris, sclera, and pupil of the eye show the veil the soul has created through consciousness or forgetfulness that reflects the illusions which prepares the soul for attaining the reality of full enlightenment. We are spiritual beings having a human experience. And the features in our eyes, the features that are there, the different patterns and pigments and colorations and accumulations and fiber structures, radial furrows, contraction furrows, lacunas, it's all frequencies, and it gives us information like this. The image on the left, the yellow pattern, is a note with a speaker, one note with water and light passing through it. And it told me like, oh, and it vibrates to that, go, oh, and the pattern changes. That's frequencies. Well, over here in the iris, all of the lacunas, all the patterns of the trabeculas, if there's contraction furrows, radial furrows, I'll show them to you. They all contain frequencies that are there genetically, and they have thought and emotional patterns attributed to them. That's science. It's not just, when I was doing this stuff, I started when I was 25 years young. That was 75 years ago. Well, I'm just joking, but I was preaching, teaching, practicing holistic health, and that what you think and feel affects your physical body. And I'll tell you what, back in 1975, 1976, oh my gosh, I was an island. I was, oh, Pesek, he's a quack. He's talking about thoughts and emotions. That's nothing to do with degenerative diseases. Diet has nothing to do. Yes, I lived through that and have been a pioneer for all of that to get to this point where we have a Congress for 22 years on integrative medicine and holistic iridology. This is a pattern here of iron filings. And then on the other side, the iris, you see it's a strong iris, but that's the same concept. It's little fine iron filings on a steel plate with a note being played underneath it. And that frequency, that hertz, vibrates all the iron filings into that pattern. And I think it's phenomenal that it looks like an iris. Here's another one. That's a powder called the lycopodium powder on the left side. Every feature in the iris is frequencies, and those frequencies are energy. Some energy is strong, some energy is weak. So what do you think all the time? What's going on up here in your cerebral cortex? Are you happy? Scientific evidence shows that thoughts and emotions affect and alter our DNA. And our DNA affects our emotions, attitudes, and behaviors. That's science now. Science is caught up. Look, I wasn't the only one in the last 45 years preaching this kind of stuff and talking about it, but it's great, very gratifying now to see that it's catching on, that it's getting traction, and that science is showing your thoughts and feelings affect your DNA. You can rescript it. You can rescript it. It's called epigenetics. You are capable of reprogramming the DNA code to transmute ancestral issues that are not healthy or not for your highest good. How do you find out where you need to work? Holistic iridology will gain access, and I've created the system to help decode what's the code in the DNA. How did I do that? Was it throwing darts on a wall? No, I'm not, as a naturopath and a psychologist and a couple doctoral degrees and a couple honorary doctoral degrees and da-da-da-da-da. It's all nice. I've earned them. I've achieved them. That's great. But what I want to teach you, how can you heal yourself? I've got a lot of foundation. And so what I'm getting at is, as a psychologist, I was a psychotherapist. I'm retired from that now. But I spent tens of thousands of psychotherapy hours with patient clients, and everybody had iridology readings. And I was able to look over thousands of hours of counseling and thought and emotional patterns that people had in seeing things in their eyes. And the patterns were similar over and over again. And so I started to branch out and start to ask people about this. And they said, how did you know that about me? It works. Los ojos son las ventanas del alma. The eyes are the windows of the soul. The data contained in our DNA is equal to 35 million hours of high-def video in our DNA. 35 million hours of high-def video. And with all that, good health is your choice. It's a choice. It's not a curse. If you don't have good health, work on it. You can change it. You can rescript your DNA. We can learn how to do that through a holistic iris analysis. Now, iridology, holistic iridology, is not used for diagnosis of diseases. Rather, it is used as an effective system of assessment for conditions and levels of health. Conditions and levels of health. We do not diagnose medical degenerative diseases using holistic iridology. It's not necessary. I want to get to the root cause. not the end result. So we say to everybody, no diagnosis. You got it? No diagnosis. You don't need it. So that concludes my presentation. I'm only joking. I'm just getting started. But there you go. If you want to contact me, go to the holistikiridology.com website. That's simple, holistikiridology.com. Give me a call. You know, text me on my WhatsApp business. Email me. I'm happy to talk to you. Nature photography is my hobby. I've been doing photography since I was 10. I was 90 years ago. This is a very special picture to me. This is the late Bernard Jensen. He's been gone in February, will be 21 years he passed. And when I met Jensen for the first time, he saw something in me as a young guy and said, Pesek, you know, David, one day you're going to be an iridologist. And I said, I am? Like, I just met you, dude. And he said, yes, son, with that kind of grandfatherly, fatherly energy. Why, David, you could make a living doing iridology, and I'm going to show you how. Well, what a blessing. I have no idea. That man took me under his wing. I was his pet student for 7 years. For 7 years, from 1986 to 93, when I graduated with a PhD from an accredited school in iridology, with Bernard Jensen as the dean of the department. What a blessing. What a journey. I'm on my path. Gracias a Dios. This is Jensen at his office in Escondido, California, around outside of San Diego. And then this is a picture of my Center for Effective Living. 7,000 square foot of integrative healthcare, 14 doctors and therapists, all under one roof. 1985. 1985. Cutting edge. There I am as a baby with Dr. Jensen in my clinic. I was at his, he slept in my home. I was in his home. Now at this point, he's been gone almost 21 years. People don't remember him as well. His daughter-in-law, Ellen Tart Jensen, is doing a wonderful job carrying on his legacy and teaching. And she's an amazing naturopathic doctor. His daughter-in-law, Ellen Jensen. Name and lights. Worked a lot of hours, 60, 70 hours a week. Not anymore. Chart to holistic iridology. We don't have time to go into it. I'm watching my stopwatch here and my time. For those of you, if this is totally new to you, go visit the website, Holistic Iridology. But basically, every gland and organ is reflected. There's a neurological reflex for every gland and organ in the body is reflexed in the iris. How old this science goes back, recorded history, as best as we've been able to discern through archaeological and anthropological things and research, 3,000 years. Iris, a form of iris analysis on this earth for 3,000 years. And it's all been physical up until the last decades. The right eye is masculine energy. It's the same for a man or a woman. The right side is the masculine energy. You can see around the collarette here, these is all the endocrine glands, the brain area, the lung over here, the kidney down below around 6 o'clock, and then the left eye. I mean, I've got, in the courses, I have hours of lecture going over just this as a chapter and helping you understand it to read the eyes properly. The left eye is feminine and will represent your issues, feminine issues. There are 3 basic colors of eyes. The blue eye, which is called lymphatic. The brown eye, which is called hematogenic. And then the mixed of the 2 genes called biliary or mixed biliary. And that is a blend of blue and brown eye genetics. Now, the fiber or trabecula connective tissue, the structure of the iris, which is predominantly connective tissue, and it has nerves and blood vessels in it, is a genetic blueprint from birth and does not visibly change throughout life. That's the fiber structure. However, conditions and accumulations will show changes on and around the iris over time. So what's a constitution? People ask me, what do you mean by constitution? It's your ability to withstand stress, to meet the demands of your environment on all levels, spiritual, mental, emotional, and physical. Your constitution, your strength, your genetics. You know, some people are weaker and they get sick more often, or they get injured more often. And some people are built like a tank and they just go through stuff and they don't get sick and they push through aches and pains. It's a constitutional factor. You take a look at this picture here and you can see the different fiber structures. Very strong, good, fair, poor constitution genetically, and then over here, weak constitution. So the strong genetics, I've got to go quickly. There's a lot I want to cover just to show you how the eyes reveal the thought and emotional patterns. The strong constitution, strong mental and emotional capabilities with a minimal amount of hereditary challenges, a high level of enthusiasm, like this tight weave fabric. The iris fabric, the connective tissue is strong. It's got a good density to it. Looks like this. Now, the medium, this is where most people fall into it, medium, and I'm talking globally. I'm not just talking about the US. I'm at 60 countries. I've been all over, New York, being in Manhattan, and seeing hundreds and hundreds and hundreds and hundreds of people from all over the world sit in front of me while I could read their eyes was what a blessing and a learning experience, having the world come and sit before me, people from around the world of all different nations, nationalities, ethnicity, all of us. What a great way to learn. So the medium constitution, there are fluctuations in levels of enthusiasm, and there's a moderate amount of genetic challenges. You see the holes in the fabric? Just a kind of a comparison, an analogy, if you will. And you see these holes here? Those are called lacunas. Now, you guys that are graduates, you should be able to give this lecture. What do you think? You think you could? And then the weak constitution, the decreased mental and emotional, increased amount of hereditary challenges, a tendency towards suppression. Look at this weave of this fabric. Low trabecular density. Now, there's something that's important for all of you. You might, for those of you, you might, when this lecture is over, you might go in a mirror and look at your eyes and see something. You are perfect just the way you are. And I have never seen a perfect iris, and every iris I have seen is perfect because you're perfect just the way you are. And whatever genetics you were born with, whatever you created, or your consciousness or forgetfulness that reflects your illusions, which helps prepare you for attaining the reality of full enlightenment, is divinely perfect. And you go from there to get stronger and work on things. Believe me, even the strongest constitutions that I can see in somebody, they have their stuff. Everybody has their stuff to work on. Me too. Good health is your choice. Good health is your choice. You got to work at it sometimes and earn it, especially that our environment, we're under siege in the air and the water and the soils and the foods. Oh my goodness, you know that. In the soup of EMF, we're going to have a lecture later by Jody Rabinoff from Israel and her awesome products. The EMF toxicity that's out there. It's horrible to think, but you know, somebody's texting pictures of their grandchildren through your liver right now. Your whole body is all those frequencies are going through. We have to protect ourselves. This isn't 1750. It's 2021. I like this again. This is my hobby, nature, wildlife photography. Constitutional iridology. I studied with the Germans. I lectured to the Germans at the most prestigious iridology event in all of Europe. I was honored to be the only American ever invited to speak there. Even I could even say English speaking person to speak there, other than one lady from South Africa. Constitutional iridology based on subtypes of structure, accumulation, and color. And I have been through all of my research, have attached thought and emotional patterns to every one of these physical iris features that is amazingly accurate. The lymphatic iris, the blue iris, as I showed you. Now, this is not everybody with blue eyes, but the predisposition generally is emotional pain, issues with forgiveness, a diminished flexibility, mentally, emotionally, and physically, and limiting self-perception. I could go into it and show you eyes for an hour on it. Don't have the time. We're going to get through this. Hematogenic iris, the brown eye, okay? Anger and resentments, these are opportunities to heal. It's not negative. It's what you, on your soul level, created to reflect your illusions to help you get to a higher level of consciousness, not just a healthy liver. Repression of expression, emotional fluctuations, difficulty receiving from others. The biliary iris, the genetic combination, difficulty receiving, anger, resentments, grief and sadness issues, feeling vulnerable. But what do I know? I'm a psychologist with tens upon tens of thousands of hours of psychotherapy with patients, clients, and doing iris analysis on all of them. What I'm sharing with you right now in holistic iridology is a gift, meaning that it was a gift to me. I've been inspired to go down this path and to be the messenger of this information. Lacunas, they're thought forms, belief systems held in the body from genetic memory. There's different levels of them: suppression, chronicity, depleted, degenerative. All of these little ovals and circles, for those of you that are just being introduced to this, these are all lacunas, and they all carry frequencies in them, and they all mean something on a thought and emotional level. Like these rocks, I like nature. They look like lacunas in rocks. The collarette, feeling out of control when your collarette is distended, and a tight collarette is emotional holding. That's the collarette with the arrows pointing to it. There's different names: collarette, minor arterial circle, autonomic nerve wreath, sympathetic and parasympathetic nervous system. Some people think it might be the vagus nerve. That notion hasn't really caught on over the decades out of Europe, but it's been, the possibilities have been brought up. This gray area right here, that's a gastric ring, challenges in receiving, feeling unworthy to receive, and not digesting proteins and minerals properly. All the orange pigments relate to the pancreas on the insulin side of the pancreas, and the insulin side of the pancreas relates to grief and sadness. If somebody, you think TCM's got a little bit different notion to it, some TCM does, and I have my reasons, explanations, and rationales for a few things that are different, like the lungs are survival, not grief. Just look at the vastness of just one galaxy out in space, in the universe. One galaxy that contains billions of stars. And we're circling around this little planet around one star. But you're much bigger than that. You're a spiritual being having a human experience. Contraction furrows. These are people have an active mind. They're discerning, withheld communicating, internalized stuff, unexpressed thoughts, emotions, memories. There's so many things to talk about: what nutritional treatments there are, what kind of physical exercise is necessary for these different people. But you see all those little creases? Those are called contraction furrows. and they have psychological meaning. There's different patterns. I have divided the contraction furrow phenomena in the iris into three categories. There's concentric, there's mask tetanic, and random tetanic. But what do I know? I've only been doing this research for 35 plus years. Oh, I kind of say that a little, I don't know. Forgive me for that, but you know, maybe a bit, I don't know, sarcastic or something. I don't know. I don't know. It's this stuff works. It's so accurate. Some people are stubborn. They don't want to change. Oh, what I know is right. Growth rings on a tree. The similarities in nature, they look like contraction furrows. You know, here's a big pupil. You know, here's the collarette. All the contraction furrows around the outside. Now, detoxification. The systems of detox, elim, and the endocrine system, they're all colored in. All of these colored in areas on the eye chart, all are taught with thought and emotional aspects to them throughout the three levels of the course to help people get to the root causes. So if there are contraction furrows, if there are lacunas, if there's strictures in the collarette, if there are pigments somewhere in the bladder and the urethra, or there's a pigment in the left lung, they all mean something that's there, that's underlying. They could even be subconscious to you. Even the brain area. I've advanced the brain area as a psychologist, naturopath, because I've been doing all of this, talking with the people, and it's a contribution of iridologists from the United States over the last 120 years. This is the scale of thought and emotion. I'd like to go over all of this with you, but in the lectures, in the seminars, there's hours of this teaching you about every step on the way to help people get to letting go of the past, forgiving, and then reaching consciousness and enthusiasm in your life. One of the things we need to do is detox, right? Detox, detox, detox. Don't take it for granted. Oh, I'm okay. Listen, what did you do before you started getting healthy? If you started getting healthy 10 years ago, what did you do 20 and 30 years ago? Some of that stuff can still be inside your cells, in your organs. So the skin is feeling our environment. The skin, healthy skin, is consciousness and enthusiasm. It's on the outer edge of the iris. This here shows underactive skin. The world is a harsh place. There's trust issues. Look, I'm trying to get a few words on the bottom of the picture. It's way deeper than that, but that gives you an idea. There's the trust issues here. People have been violated. They've been betrayed. We've all been betrayed, but this is major issues. This is little Dingy. I swam with Dingy down in the Florida Keys, and I'm getting dolphin kisses here. Look at, she's even closed her eye. I swam with Dingy in 1986, in 2009, and in 2018. All of those years, 33. She's probably about 45 now. She's up there. She's the matriarch of the dolphins at Dolphins Plus in Key Largo, Florida. And believe me, they remember. I can tell you stories. They remember. They're intelligent beings. Lymphatic system, issues of limitation. I can't take it. I can't move forward. I can't do it. Okay. Does that sound negative? Yeah, maybe it does, but it's helping you understand what your underlying thought and emotional issues are. It's very powerful. It's beauty to find that out. Now, where are we at with lymph? Way down here in apathy. I'll come across here. I'm not good enough. I don't feel like it. I can't do it. What's the use? I'm helpless. I don't have enough money. I'm not smart enough. I'm too old. Oh, stop it. Those are all limiting illusions. Illusions. What you think and what you speak into, you manifest. Be careful what you think and speak into. The yellow is the ducts, nodes, and fluid, and the purple, spleen, tonsils, thymus, Peyer's patches, appendix, all those little cloudy puffs, lymphatic system congestion that is congenital. It's there from birth. Some of it's continuous. It's all being taught in the classes, but these are issues of limitation. What can you do for yourself in the beginning before you even, I am, I can, I choose, I will, I create, I have, I love, I enjoy. I am, I can, I choose, I will, I create, I have, I love, I enjoy. Renal system, the kidneys, forgiveness, the bladder, even more sensitive emotions of letting go and forgiving. Where are the kidneys? Look, they're right up here. Look how high up they are. Forgive, forgive, forgive. Forgiveness, love, and forgiveness. I'm working on it. I think I'm a pretty loving guy, pretty forgiving person, but there are some times that I'm not so forgiving, and that's my imperfection. You know, I'm working on it. But the more that we can forgive and love and let go of the past, look at where it takes us to consciousness and enthusiasm. The orange, all that highlighted, is the kidney and the bladder, right? Bladder, urethra, kidney, and it's striped right here because there is called, it's a dual reflex area. And the leg is superimposed at 6 o'clock. The hip, the knee, the ankle, the foot, is the leg is right there in the iris as well. Water, water, water. We've heard lectures. We're going to hear more about water. We talked about hydration. Phil was talking about it. Phil Wilson was talking about it earlier this morning about water and frequencies and far infrared and all of that. And look at all the composition of our body and how much of it's water. How much do you forgive? A rarefaction in the kidney reflex area, and then all the other areas are pointing to the overacidity of the tissues. Overacid. Overacidity is inflammation. Inflammation is the precursor to degenerative diseases. Here, there's the waffle-looking pattern of a lacuna. That kind of lacuna is a very, very serious lacuna for potential pathology. I don't have to diagnose that they've got renal failure. They don't have it. This was in their eyes when they were born. You look at that at 5 years old, 10 years old, they don't have a kidney problem. Down the road, if they have forgiveness issues that are unresolved, they're going to have a kidney challenge. So medical establishment is saying, oh, well, you're saying, Pesek, this person has a kidney disease. I said, no, I'm not saying it has a kidney disease. I said they have a predisposition for a kidney challenge. And I'm not going to label it because I don't know what they're going to manifest. Hopefully nothing. Hopefully they manifest wellness. But the pattern is there. The influence is there. The frequencies are there. Undeniably. The respiratory system, survival issues, fear in relationships, the breath of life, letting in spirit, gestational end or birth. This is an amazing, amazing area. Where is it? All the way down here, survival. My folks that might know some TCM, I beg to differ. It is not grief. It's survival. I talk about it in the seminars. All the blue areas are all part of the respiratory system. And there's another part of the respiratory system that's over here in the medulla that's called survival in the brain area. There's the medulla. This is the anatomical brain. And here is the holistic iridology interpretation of the brain areas. This is an inspiration from Bernard Jensen. Bernard Jensen's inspiration came from J. Haskell Kritzer and Henry Lindlar. Henry Lindlar and Kritzer's inspiration came from Henry Edward Lahn. It goes back all in the United States. Proud of that. This is how the chart lays out on the brain. gestational and or birth trauma, breathing difficulties, resistance to inspiration from the creative emotional aspects, concern about survival in emotional relationships, either experiential or from hereditary factors, emotional relationships because it's the left eye, the feminine eye. I'm talking fast. I hope you're getting it. We got a rarefaction here in the lung, a hyper area in the medulla, and an adrenal weakness with this big lacuna in the adrenal gland. That's survival issues. It's the right eye. Survival issues in career, business, and finance. Also, it's a triad for the syndrome of asthma, breathing difficulties. I bet you if you have asthma, I could find those features in your eye if you had it. Cardiopulmonary challenges, survival and love relationships, this pigment, these lacunas, these vascularizations in the sclera showing potential pathology. What fits your busy schedule, sir? Exercising 1 hour a day or being dead 24 hours a day? Tiger lily. The liver, resentment and anger, that's got to work with it. I won't, you can't make me, I'll get even, I hate that, I'm so mad, look what you did. Right here, anger. Liver, gallbladder, and the thyroid, parathyroid. Like, I won't, you can't make me, I'll get even, I hate that, I'm so mad at you. That's negative. It hurts. The person who feels the anger is hurt a lot more by the person who you're intending or who you're sending the anger towards. It hurts you more. Over here, there is a gallbladder, liver, common bile duct reflex area. Some people think that the liver is here. And also over here, I have consulted with one of my graduates in Spain who calls it multi-reflex iridology. He and his father, he's second generation of research in reflexes, like here, the leg, multi-reflex, and they have not found the liver reflex to be here. That came from the late Joseph Angerer of Munich, Germany. Opportunity to heal deep-seated generational issues of anger and resentment. A topostabile melanin pigment. That was there. That is genetic. Probably showed up when they were 4 or 5 years old, but it's there. And it just screams out of what I've got the text underneath. An opportunity to heal deep-seated generational issues of anger and resentment. Here's a vascularization in the sclera. Liver congestion and inflammation. It's acquired, unresolved anger and resentment issues. And now this is pointing to pathology in the liver. I can't label it. I mean, even if I could, I would send them for medical testing for the liver. I'd start with blood work and liver enzymes. Corneal arcus, this is on the cornea. It is a liver-related sign. It actually, the old days, it was called a sodium ring. That's antiquated. If anybody out there studied and you learn this as a sodium ring, that your level of learning iridology dates back to the 1940s and 1930s. I'm sorry to tell you that, but that's the truth. You need to get up to speed, whether you're with me or somebody else, get up to speed. This is calcium and lipids. It's a calcium ring. And when they clear out arteries, if people have the plaque in them, it's a lipid and it's calcium. And it can form on the posterior side of the cornea. Really, let's face it. We can say, oh, blah, 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 and we can turn our heads and you can pinch your nose and close your eyes, but it's pretty toxic out there. We can all go to Hawaii, on the island of Kauai, but then it might look like the previous picture. How about this? Drug palace. Oh my God, a palace. What about, they say I'm going to the drugstore. That's right. Call it what it is. The doctor gave me a prescription for medicine. It's not medicine. They are drugs. Now, I can't see this real well because I've got a little toolbar over this, but it says, I take metformin for the diabetes caused by the hydrochlorothiazide, which this guy got from the Ambien he took for insomnia, caused by the Xanax he took for the anxiety that he got from Wellbutrin. He took for chronic fatigue, which he got from the Lipitor he took because he has high cholesterol, because a healthy diet, regular exercise, nutritional supplements, and a positive, loving attitude are just too much trouble. You know what? This is not a joke. This is sad. And what you see right here, every one of those things working its way down, those are the primary symptoms for those chemical drugs. The colon, large intestine, a small collarette, I mentioned this earlier, inward holding, tight suppression of expression, people that need to be in control, a distended collarette, feeling out of control, behaviors influenced by others. Okay, look at where letting go is. Look at the colon and the kidneys and the skin. Colon, kidneys, skin. There's more. I mean, we can talk about hypothalamus, pineal, the endocrine glands, the heart, which by way is also an endocrine gland, besides the muscle that pumps and circulates your blood. But letting go of the past, let go of the past. Forget about it. That's the reflex area of the colon, large intestine. There's charts. Here's a chart that shows you all of the thought and emotional correlations. How do I know that? Because in my clinic, we did 2,000 colon hydrotherapy sessions a year. 2,000. Everybody had iridology. Normal, healthy colon, balance of receiving and letting go. These are the real weapons of mass destruction. There's more, but there they are. Processed, refined, empty, sugar and fat laden, hydrogenated oils, sugars, refined white flour with aluminum in it and gluten. GMOs, there it is. Take your pick. Bye-bye. Colon hydrotherapy, that's the kind of unit we use. This came out of a lady. I gotta tell you a whole story behind it, but that piece is 3 feet long on our tissue cleansing fasting program. I'll have you look at something better now. This is her. Her name is Nilsa. Look how happy she is. She was lighter in energy, in love, the burdens that she had, the headaches. Oh, phenomenal. I gave her a t-shirt. I pooped today. Because good health is your choice. You take time. Take time to smell the flowers in your life. Really, think about it. What were you doing just 5 years ago? It's 5 years down the road. I mean, when I look at that at this point in my life, you know, when I was 25, I was like, hey, what the heck? I got a lot ahead of me right now. But realistically, I have fewer years ahead of me and more years behind me. And I'm very healthy. I've had blood tests and hair analysis and cardio tests and all kinds of stuff. And I'm as healthy as I was strong when I was 40. And my next birthday, I'm going to be 72. So I strive to do myself personally what I teach people to do. You could, if you want to learn how to do this, you can get a light and lens, about $73 for that. Or you can get a camera. I've been, like I said, I had a camera in my hand since I was 10 years old. I've been working with iris imaging systems for over 35 years, and I built a couple of different systems. Excellent, excellent. You won't find anything better in its class. Please, if you have that little eye cup thing from China, that's not an iris scope. It's not an iris camera. It was a dermatology camera for estheticians to show people moles and spots and pigments on their body. It's not an iridology camera. It is not. It's a piece of junk. I'm sorry. If you don't get my camera, that's okay. But don't waste your money on that stuff that's $300, $400, $500, $600, $800. And then especially software. Oh my goodness. Don't get me started. Come on, I've been doing this a long time globally. So this is the camera, how pretty it fits into a case. They're highly portable. Put it on an airplane. I've taken my cameras to Hong Kong, to Taiwan, to Mexico, to Puerto Rico, Canada, Europe. In that case, in the aircraft luggage hold, not in the overhead, comes out perfect. My students out there that are waiting for it, if you're listening to this lecture and you're waiting for the software, I promise you in the first quarter of next year, when we get through the holidays and I have other commitments, we'll get this software finished for you. But it will accommodate every human iris. Every human iris. All 7,800,000,000 people with 2 eyes. This chart will fit their iris features perfectly. You have to help it, but it'll do it for you. And it doesn't, scanning software is not realistic right now. It's not. Artificial intelligence for an iris, not yet. I'll teach you how to read an eye clinically. The balance, thought and emotion, spiritual, mental. Read that and take it in. You are filled with the power of infinite possibilities. You could be like a little butterfly. And the butterfly was a caterpillar, right? And it makes this little chrysalis kind of cocoon, and then it liquefies. It's amazing process. And then it emerges as a butterfly. And that's you. You can be this. If you feel sometimes like a creepy, crawly little caterpillar with your health, your emotions, your aches and pains, your mental attitude that you're not zippy and you need have the, where's that vibrancy? Oh, I'm 50 now. Baloney. Baloney. You have the ability to metamorphose yourself. Epigenetics is a scientific fact. You can change and alter your DNA. But where do you start? You can start by using holistic iridology to get to the underlying subconscious thought and emotional patterns that can drive your behavior, and you don't even know it's doing it to you. What you've been learning about, thank you for listening. I'm not done, got a minute. The new iridology, the new iridology. There's other people out there that laughed at me when I was doing thought and emotion, and now they're trying to mimic. Okay, God bless them. It's okay. It's making a difference. I think I got a head start, 35 years, and a psychologist, and a naturopath, and a holistic iridologist, and a licensed clinical nutritionist in Florida. And when I grow up, I'll figure out what I want to do. But this is my passion. Do you get it? Do you get it? This is my passion. I want to share it with you. Because I'm looking for serious students who desire to become professional, holistic iridologists. Are you one of these people? I hope so. And if not, it's okay. I hope that this lecture, this presentation inspired you, opened your eyes, no pun intended, to look at yourself holistically, to question your wellness and know that you have the ability to be well. Even if you don't study with me, to become a holistic iridologist. That's okay. If you're meant to be, you will, and you'll earn this. You will earn this. I've had people try to buy it. Literally, hey, doc, how much does your whole program cost? I will pay you fully for the whole thing if you just give me that diploma. Absolutely not. You earn it. And when I sign it down here, that is not an ink printed. I personally sign with love your diploma, your level 3, your level 2, your level 1. I sign them all. And I hope I will sign them forever and not just print them out with my name on it. Something to be proud of, because I think I'm one of the best on the planet. And it's a gift. I'm a messenger. Please understand that. It's not ego. It's knowing who I am in my mission on this earth, in this lifetime. I have been blessed and led to this path. And it's been an amazingly divine path that I've been on. Come join us if it's meant to be. If you feel it in your soul to study this, even for your family. But remember, good health is your choice. Thank you for your attention. Thank you for listening. I hope that I reached you and touched your life in some way and shed light on it and opened your eyes. Again, you can contact me at Holistic Iridology. You'll get the phone numbers, the emails, everything. HolisticIridology.com. And get a professional iridology education. And you can do circles around any other courses that are taught. But that's not the issue. It's helping people because it's holistic and it gets you to cause. So thank you. God bless you.